It's pretty incredible how this video continues to generate comments such as this. I mean, this is tame compared to some of the vitriol on the video. So let's talk about this a little bit more. I have many patients on these medications that I mentioned on that video. And let me tell you something, one of the easiest things to do in my job and in healthcare is not to rock the boat. A patient comes in, they're on these medications chronically, and they want them refilled. The easiest thing for me to do is just ask them, are you okay? Do you want to keep taking them? Okay, here's 3-4 months supply. I'll see you later. I can do that in literally 2 minutes, and that would be the easiest part of my day. But remember, easy isn't always the right thing to do. The hardest thing to do in my job in many parts of healthcare is to have a conversation. I can either write a prescription that takes 10 seconds to send electronically, or I can have a 20-minute conversation about some of the issues I'm concerned about with the medications in my video. How long have you been on these medications? What are they actually doing for you? Are you aware of the long-term risks and complications? Have you tried taking less? Have we tried alternative? What other modalities have you tried to alleviate some of your symptoms? What are you afraid of? What are you scared of? What do you think is going to happen when we try to cut these doses down a little bit to avoid some long-term risks that I see in many other patients 20 years from where you are today? Those are the tough questions, the tough conversations that takes much more time, is much more time consuming, and makes my day a lot harder. But that's what we do. We are paid to have hard conversations sometimes. Because it is those hard conversations that sometimes we make better decisions than just maintaining the status quo, which has a lot of risks you may not see, but I see because I take care of those people 10, 20 years from today that are in a big heap of mess because they've been taking a lot of these medications at very high doses for too long and no one had those hard conversations with them. So if your doctor isn't having those hard conversations with you, those long conversations, looking at other options, looking at alternatives, talking about risk and benefit, you're probably not getting the optimal health care that you deserve. I, on the other hand, choose to have those difficult conversations because I care about my patients, what happens to them a week from now, a month from now, 10 years from now, and at the end of their life.